Hey guys, this is Dr. Hub. Today we are looking at the management of the female infertility. So in terms of the tubal cause. So under the tubal cause, the investigations to be done are the hysterosalpingography or the sonosalpingography. Next is the phalloscopy and salpingography, as well as the laparoscopic chromotubation. Now let's look at the management of the tubal cause. So how do you manage? The management is by the laparoscopic adhesiolysis. So there is laparoscopic adhesiolysis. Then there is also the tuboplasty can be done. There is tuboplasty, and there is the hysteroscopic cannulation. There can be hysteroscopic cannulation and also the ballonoplasty. So there is ballonoplasty. So in case all of the above procedures fail or not feasible, so in case others fail, we move on to the IVF or the gift. So we had laparoscopic adenolysis, tuboplasty, hysteroscopic cannulation, ballonoplasty, and if it fails, the IVF and the gift is done. Next we move on to the ovulation related. So in terms of the ovulation related, the investigations it contains, there is ovulation monitoring by the ultrasound. So there is ovulation monitoring by the ultrasound. So that includes the BBT as well as the BBI, and the endometrial biopsy for the tube B is done. So the endometrial biopsy, and this is for the TB is done. And if the above steps are abnormal, do a hormonal study. So in case others are abnormal, we do a hormonal study. Then in terms of ovulation related, there is the FSH-LH is done. FSH-LH as well as the prolactin, they are checked, and the E2P level is also checked, and there is a thyroid and diabetes is looked for. Thyroid and the diabetes. Now what is the management of the ovulation related? The management of the ovulation related, there is the clomiphene and the letrozole. There is clomiphene as well as letrozole. There is clomiphene and the letrozole. So in case the clomiphene and the letrozole it fails, so in case it fails, then we administer FSH as well as the LH. So FSH-LH or the GnRH is administered, and what we do is we have to check for the response. If there is no response, we do the IVF donor egg. And if all the above measures fail, then final option is to adopt. So if everything fails, go for adopt. So in terms of other causes, so there can be other related causes which leads to infertility. So there the investigation should be the USG, MRI, the SSG as well as the hysteroscopy. So in such a case, how do you manage? So we have to find the cause and you have to treat the cause.